Hello everybody and welcome to the Thursday edition of Video Clips, and I'm going to talk today about the ketogenic diet. I get a lot of inquiries about this. There are enormous numbers of misunderstandings about this particular diet. So the misunderstandings range from the conditions for which it can be useful to the right way to adopt it. So a lot of people claim to be eating a ketogenic diet. When I explain what it is, you'll see that they clearly are not. And many of the claims that are currently being made about its ability to help people are just patently false. So we'll just start at the very beginning here and give you some perspective. The ketogenic diet is a very high-fat, low-carbohydrate, extremely low-carbohydrate diet, in fact, that has been used since 1921 as an effective treatment for several forms of epilepsy. It's been primarily used for children, but there is some evidence that epileptic adults can benefit from it too. The best experts on the diet are at Johns Hopkins Children's Center. The mechanism of action that explains the efficacy of the ketogenic diet is that it mimics a fasting state, and fasting has been shown to be a treatment for seizures since ancient times, believe it or not. Within a short time after beginning a fast, the body stops using glucose for fuel and converts to using stored fat for fuel, a state known as ketosis. During ketosis, ketones are produced, which are usable as a substitute source of energy for both the cells in the body and the brain. The ketogenic diet results in the same effect. Restricted carbohydrate intake results in burning dietary fat for fuel, which allows for a much longer and extended time of mimicked fasting. Fat stores are used up within a relatively short period of time, but if you're living off of high dietary fat intake, this can go on for a very long period of time. Research shows that the diet actually works for its stated purpose when it's adopted properly. A 2001 study at Hopkins shows that 75 out of 83 epileptic children who ate a ketogenic diet for a year had either partial or full resolution of their symptoms, and improvement was sustained after stopping the diet. In another study, 65 epileptic children between 18 and 24 months were assessed before starting and after 1 year on the diet. For those who remained on the diet, 52%, and you'll understand why remaining on the diet can be difficult in just a few minutes, mean seizure frequency decreased from an average of 25 seizures per day prior to the diet to less than 2 per day, and was accompanied by significant improvements in both attention and social functioning. A meta-analysis of 11 studies showed that 16% of children experienced complete resolution of their symptoms, 32% experienced a 90% reduction in seizures, and 56% had a greater than 50% reduction in seizures. While ketogenic diets can be effective, there are side effects, and this is why sometimes people don't stick with the diet. One study of pediatric patients treated with the Johns Hopkins protocol showed that during the first 4 weeks, dehydration and gastrointestinal complications are common. And infectious diseases, aspiration pneumonia, hyperuricemia, hypoglycemia, electrolyte imbalances, acidosis, hepatitis, and acute pancreatitis have been reported. After 4 weeks, patients remain prone to all of these complications except for dehydration, pancreatitis, and hyponatremia. And almost 15% of patients, osteopenia, kidney stones, hydronephrosis, iron deficiency anemia, and cardiomyopathy developed after 1 month in ketosis. Some patients dropped out of the study due to the side effects of the diet. Vomiting, constipation, kidney stones, and an increase in cholesterol are common side effects. Kidney stones can be prevented by supplementing with potassium citrate, and cholesterol levels return to normal after the diet is stopped. The bottom line is that while the diet is effective for most of the children who adopt it and stay with it for a period of time, there are side effects, and patients have to be carefully monitored while using the diet for medical treatment. The diet is only used for a short period of time, the shortest period possible, and for many parents of epileptic children, the benefits outweigh the risks, since the drugs that are used to treat childhood epilepsy are notoriously ineffective and have even more side effects. Interest in ketogenic diets has increased recently, in part because of the positive effects fasting has been shown to have on cancer patients. Animal studies have shown that fasting is effective for reducing the side effects of chemotherapy and for decreasing circulating IGF-1 levels, which are a known risk for cancer. The same effect has been shown in human subjects. Fasting can be an effective strategy for both preventing and treating cancer because cancer cells are weakened and normal cells are strengthened in response to food restriction. Now, the reason for this is that when you think about it, humans are quite adept at surviving for long periods of time without food. Historically, we had to do it and live through those periods of time. So under those circumstances, we burn ketones for fuel while cancer cells just can't survive on ketones. Water-only fasting can be undertaken by many people for a few weeks, and it can be safely undertaken by an obese person for many, many months. But people can't fast indefinitely, and some aggressive cancers, particularly brain cancers like glioblastoma, do not completely resolve after a few weeks of fasting. Traditional diets are notoriously ineffective for these patients traditional treatments, I should say, are notoriously ineffective for these patients who have pretty grim prognoses at the time of their diagnosis with only a few months to live in many cases. Tom Seyfried, PhD, has spent his career studying the use of metabolic therapies to manage many chronic and difficult to treat conditions like epilepsy and cancer, the two that we've been talking about. In his book, Cancer as a Metabolic Disease, he provides extensive documentation showing that cancer is not a genetic disease, but rather a mitochondrial metabolic disease. This isn't a new idea, but it was largely forgotten for a variety of reasons, one of which is that expensive, profitable cancer treatments like surgery, chemotherapy, and radiation have become the standard of care for cancer patients. He proposes the use of several therapies, which include calorie restriction, which happens as a result of adopting a plant-based diet, water-only fasting, and a ketogenic diet for addressing difficult-to-treat cancers. He presented a lecture on this topic at our conference here last November, and he cited a few case reports, one of which was very interesting. It was a female cancer patient in France who lived for 7.5 years on a ketogenic diet beyond her expected death date. That's almost unheard of for glioblastoma patients, so impressive. Doesn't make the case entirely, more research is needed, but again, it's impressive. So this brings me to the current misunderstandings about the ketogenic diet, which originate both from those who advocate a plant-based diet and those who promote paleo and other diets. First, the Paleo Diet and the Atkins Diet, just let's start there. These are not ketogenic diets. Just eating a bunch of animal foods or eating a bunch of saturated fat while restricting grains and beans it doesn't result in ketosis, which is required for the diet to have any type of therapeutic effect. A ketogenic diet, if done properly and for therapeutic purposes, requires the assistance of well-trained professionals because the macronutrient makeup of the diet must be very, very specific and consistently maintained. A keto monitor is required, and patients have to test themselves several times a day to make sure that they remain in ketosis. Second, due to the side effects of the diet, some of which are quite serious, as you heard me outline earlier, the ketogenic diet should only be adopted by patients for whom the benefits clearly outweigh the risks. So, for example, a glioblastoma patient with only a few months to live is better off staying alive while taking potassium supplements to avoid kidney stones while dying with low cholesterol. On the other hand, the risk of side effects from the ketogenic diet, in my opinion, are not warranted at all for the person who wants to lose weight or reverse type 2 diabetes. Low-fat, plant-based diets have been proven to be extraordinarily effective for both of those things, and they do not have the negative side effects associated with the ketogenic diet. On the other hand, advocates of plant-based eating can become almost apoplectic when you start talking about the ketogenic diet as treatment. A diet high in fat and that restricts healthy carbohydrate foods like potatoes seems like heresy to them. They think that a very low-fat, plant-based diet is the answer for everything. Well, I got to tell you, it's the answer for a lot of things, and I've been talking about it for years, and we recommend it every day here for most people, but it's not the answer to everything. Those who take this stance, a one-size-fits-all approach to treating patients, are both practicing reductionism and abandoning the use of clinical judgment, which is desperately needed in the practice of medicine today. People are not all the same, and their age and their limitations and their current health status and medical history must all be considered when making any health-related recommendations, including those concerning diet. Dietary advice must be tailored to the particular condition of the patient and often must be combined with other treatments that include dietary supplements, cognitive therapy, exercise, physical therapy, and some conventional treatment. It's important to avoid dogmatic adherence to ideas and to think outside the box as we seek solutions for what I think is a healthcare crisis that we're experiencing right now. In summary, the ketogenic diet is an option to be considered for very specific situations for a very small percentage of people. It requires a rigorous and disciplined approach in order to be effective and almost always involves hiring an expert for assistance. The diet has serious side effects which should be disclosed very clearly to patients before adopting the diet, and which makes it only a good choice when the potential therapeutic benefit of the diet outweighs the risk. So hopefully we've cleared up some of the confusion on this issue and we can exercise a little bit more calm judgment. All right, that's all for today, and it's all for the week. As usual, pass this on to anybody who you think would enjoy watching it, and I will be back to you next week with more news.